Dr. Budoff, how do rotator cuff tears occur?
Rotator cuff tears can occur from trauma like falls or a motor vehicle accident, or they can be a normal part of the aging process. Over time, we lose our hair, we lose our bone density, and we lose our rotator cuff. So, if you look at people over the age of 60, basically 27%, or a little bit over 1 in 4, with no shoulder pain whatsoever, have a full thickness rotator cuff tear. So, if you're over 60, you're playing in a foursome in golf with your friends, and those 3 don't have a tear, it could be you. Over the age of 70 is about 1 in 3, and over the age of 80 is about 51%, meaning more common than not. So, not every rotator cuff tear is something that is what we call pathologic or a disease state. It can be part of the normal age-related changes of the human body.
What are the symptoms of a rotator cuff tear?
Rotator cuff tears, often if they're age-related, they may not hurt. But when you injure yourself or you have a tear and then you injure yourself, you get a lot of pain. It can be anywhere in the shoulder, it can radiate down to the elbow or the wrist. Hurts to elevate your arm, hurts to sleep on it. It's weak. You can't do activities. It's kind of rough.
Do all rotator cuff tears need to be fixed?
If you get a rotator cuff tear due to trauma, that should be fixed. What happens if you don't is that the tendon attaches to the bone, that tears off, and there's a muscle attached to it. That's the motor, the engine to raise your arm. So if you don't get that fixed, we use it or we lose it. And if the muscle's not attached, it'll start to atrophy. So if you have a traumatic rotator cuff tear, that is best fixed within about 3 to 6 months. Now, if you're over the age of 60, you can fully elevate your arm and there's been no trauma, then you don't really need to fix it sometimes. About 2 out of 3 will do fine with just an exercise program and an injection. And if the pain goes away, those may not need to be fixed. If the pain stays, we know that the painful tears are the ones that enlarge, the muscles atrophy, and if you let them get big, they can get much tougher to fix later. So not everyone needs to be fixed, many do.
What happens if I don't get a rotator cuff tear fixed?
If it's painful and you don't get it fixed, the muscle atrophy, that can occur as early as 3 months, it can be a couple of years, everybody's different. But again, if it's traumatic, you want to get it fixed within 3 to 6 months. If it's age-related and it hurts, it's enlarging, and it's ongoing as far as the enlargement and the tendinosis process, which I discussed in the first couple of videos on the rotator cuff. Those should be fixed. Those will enlarge and become more problematic later.
How are rotator cuff tears fixed?
I fix them arthroscopically. Compared to open surgery, arthroscopic surgery is less painful, less stiffness, and they do very well. We go in with small instruments through small incisions and fix them. It's an outpatient surgery. Takes about an hour for often less, and they do fairly well. You do have to wear this immobilizer for 6 weeks, which is quite possibly the worst part of the whole thing. But you're not allowed to reach up in the air for a couple months or lift anything heavier than a telephone for 3 months. Then you do strengthening. You get homework. It's like school. Those who do their homework do better than those who don't. But if you do your homework and you follow the restrictions, most people do extremely well.
Thank you for your time today, Dr. Budoff.
Thank you.